Here we are going to discuss about the blood transfusion. Especially, I'm going to focus about the blood transfusion reaction. Every student can see in this picture what are the sign and symptom of blood transfusion reaction if occur, right? So the patient who need the blood transfusion, after the blood transfusion, the first 15 minutes, we always with the patient. So sometimes NCLEX would ask, how long must you stay with the client after the blood transfusion? 15 minutes. This 15 minutes, we can state any kind of transfusion reaction start or not. Every student must know what are the signs of transfusion reaction or adverse reaction. The most common adverse reaction are restlessness, nausea, shortness of breath, fever, chill, or back pain, right? Fever means elevated temperature, increased heart rate, tachycardia. So there are so many. In this picture can help you how to clue it at your brain. So they explain the reaction like E, F, H. There are three letters. A means allergic reaction, allergic. F means febrile, and H for hemolysis. So I said the patient develop the itching or hives. It is actually because of allergic reaction, hives, right? So easy to remember, allergic response, A for allergic. So if patient have an allergic response, some consequence change occur. Like patient develop anxiety, wheezing, and decrease the blood pressure if the very severe cases. Also, I said blood transfusion common reaction is fever, means raise the temperature or elevated temperature. We called febrile. So if anybody have a fever, raise the temperature, so called febrile condition. So F for fever, if anybody have a fever, chill is common, and anxiety. Fever patient always have a tachycardia and tachypnea. Increased body temperature, increased heart rate, and increased respiratory rate. Easy to remember. Very late stage, patient also develop hemolysis. Hemolysis means breakdown of red blood cell. So if breakdown of red blood cell, definitely patient will start the blood pressure go down, respiratory rate go up, patient will be restless, and hemoglobin or red blood cell carry out oxygen, less of oxygen, patient feel shortness of breath, and also hemoglobinuria. So red blood cell breakdown, hemoglobin came out to the cell and passing through the urine, and when hemoglobin present in urine, we call hemoglobinuria. Patient complain chest pain and also low back pain. Some books said flank pain, right? So second question, if I see my patient have a blood transfusion reaction, what is my responsibilities? My responsibility is immediate stop the blood transfusion. So you see here we wrote within all reaction, take the steps to stop blood transfusion. NCLEX would ask, what do you do if an adverse reaction occur? Answer is stop blood transfusion and also run the normal saline that hangs with blood. Also check the vital sign, notify the healthcare provider, and also notify blood bank, and make sure urine and blood culture are done. Let me tell you some very essential information what related to blood transfusion or NCLEX board frequently asks. So before blood transfusion, every RN must know you should take the sign written consent. So sometimes NCLEX board asks what must be received before a transfusion is started. Answer is signed written consent, right? So also keep in mind before blood transfusion, we must check the blood type and cross matching. If NCLEX would ask you, in order to determine the donor compatibility, what must be done? Answer is typing the blood type and cross matching, right? Second point, before blood transfusion, every RN must check the vital sign. Question sometime NCLEX would ask, what must be done to determine the client baseline before starting the transfusion? Answer is take the vital sign. If vital sign is stable, patient do not have any history of blood reaction, they are okay to start the transfusion. Another point is here, NCLEX would ask how long must you stay with the client after start the blood transfusion? At least 15 minutes. So I wrote on the top, occur in the first 10 to 15 minutes. So blood transfusion, if any unfortunate patient have this, the reaction start within 10 to 15 minutes. So 15 minutes as a RN, always we will be with the patient, right? So now question again. NCLEX would if asked, why must you run the blood at a slow rate? So when you start the blood transfusion, always start with a slow rate because the running of blood fast can cause fluid overload. Okay. So before to finish, I want to recap something. An RN must always be present with the patient for 15 minutes. The blood is verified with 2 nurses. Also keep in mind that safest blood to administer in an emergency if the blood type is unknown is O negative. Okay. And also I said, if there is a blood transfusion reaction, our first responsibility, immediately stop the blood transfusion. This is more than enough for NCLEX board for blood transfusion.